Good afternoon. Today I'd like to talk to you about CS585, a novel drug that we've developed as a prostacyclin receptor agonist that exhibits sustained efficacy in vivo for the prevention of thrombosis. Cardiovascular disease is the #1 cause of death internationally. And we know that thrombosis is the #1 cause of death in cardiovascular disease. Over the years, we've developed a number of antiplatelet drugs to target and prevent thrombosis, including drugs targeting COX-1, P2Y12, and the alpha-2b beta-3 receptor. Those drugs have resulted in over a 26% reduction in morbidity and mortality. However, even with this reduction, the morbidity and mortality maintains cardiovascular disease as the #1 cause of death, and so we need to do better. Doing better means new targets, not new drugs to the same targets, and it means decreasing thrombosis without increasing the risk of bleeding. For this purpose, we have taken advantage of a receptor on the platelet known as the prostacyclin or IP receptor. And through regulation of the IP receptor, we think we can achieve a new target that is potent, selective, and protective from thrombotic disease. What you're looking at on the right are two prototypic prostacyclin or IP receptor agonists that are currently FDA approved and in the market. Iloprost, which is used to treat pulmonary arterial hypertension, has a very short half-life. Its effective half-life is 20 to 30 minutes, and it must be given at least 6 to 9 times daily. Selexipag is slightly better. Its half-life is 3 to 4 hours. It is also approved solely for pulmonary arterial hypertension, and it can be delivered orally or IV. However, both of these drugs have a very short half-life and hence cannot be utilized for treatment or prevention of thrombotic diseases. If you look on your left, you'll see CS585, a drug that we've developed to potently, selectively, and sustainably activate the prostacyclin or IP receptor, thus forming cyclic AMP, inhibiting platelet activation, and preventing thrombosis. How does this work? Well, we've shown in human blood that CS585 increases cyclic AMP formation. We've shown that CS585 dose-dependently phosphorylates a protein called VASP. This indicates to us that the protein kinase A downstream of cyclic AMP has been activated. And we've demonstrated physiologically that dose-dependently CS585 inhibits collagen-induced platelet aggregation. In fact, in our previous paper in Blood, we demonstrated that CS585 dose-dependently inhibits thrombin, collagen, and ADP-mediated platelet activation and aggregation, demonstrating its potential utility as a thrombotic drug. And finally, we turn to the animal model and we utilize the arteriole of the mouse to demonstrate that an IV administration of CS585 was able to potently inhibit clot formation following vascular insult. How does it stand up to the prototypic drugs? Well, let's look at Iloprost. Iloprost, in the same model I just showed you, has full inhibition of platelet activation and thrombosis with 10 minutes following IV administration. However, by 4 hours, that protection is completely gone. Within 18 hours, we also see no protection. So, similar to what has been shown for PAH, Iloprost only gives a very short 10-minute protection in the blood and has limited to no utility in regulating coagulation and clotting. What about Selexipag? Well, Selexipag is slightly better, similar to what is reported for PAH. It prevented clot formation by injury in the arteriole for 10 minutes and for 4 hours. But by 18 hours, again, full protection was eliminated and a clot was formed following vascular injury. Now, how does this compare to CS585? Well, if we look at the same administration, IV, you can see that CS585 with a single IV administration was able to prevent an injury-induced thrombotic event at 10 minutes, 4 hours, and 18 hours following that administration. Now, if we turn to oral gavage, a single oral gavage of 3 mg per kg of CS585 was able to effectively block clotting for over 24 hours. Importantly, in this figure, what you see in the third row is that at 48 hours, we can recover that normal hemostasis. What does this mean? This means that not only is CS585 effective and sustained, but it is reversible. So in summary, IP receptor is a viable target and decreases thrombosis by formation of platelet activation. IV administration of iloprost is a very short-term effect. It is only effective for 10 minutes and loses its effect at 4 hours. Selexipag is slightly better in that it can inhibit 10 minutes and 4 hours of IV administered drug, but by 18 hours you lose all protection. And then IV administration of CS585 elicited full protection for the entire 18-hour window that was tested, and in oral gavage was shown to fully protect from thrombosis for over 24 hours with a full reversibility by 48 hours. This gives us a lot of potential for CS585 as the next generation drug for a new target that has until now been undruggable in our system. Finally, and most importantly, it's my acknowledgement. I'd like to acknowledge the people who've done this work, as well as my partnership with Cereno Scientific. And with our partnership together, we're going to be able to develop a new target to effectively limit thrombosis in rare thrombotic disorders. Thank you.